right, good morning. Welcome to In the Trenches with David Cohen. Today I'm going to be talking about antiphospholipid antibody syndrome. This is a highly thrombotic state, something we should all be aware of. Basically, the antiphospholipid antibody syndrome, when do you think about it? Venous thrombosis, especially multiple thromboses in unusual locations, arterial thromboses, especially in a young person. An example would be a young person presenting with a stroke. This is something you think of. Recurrent miscarriages. And thrombocytopenia. They could get an ITP-like picture. The causes of the antiphospholipid antibody syndrome, about 50% are associated with a connective tissue disease, the most common being lupus, and about 50% are idiopathic. Okay. Diagnosing the antiphospholipid antibody syndrome. We have lupus anticoagulant and anti-cardiolipin antibodies and anti-beta-2 glycoprotein 1 antibodies. Lupus anticoagulant, this flavor is the most thrombotic, especially associated with venous thrombosis, and often they will present with an elevated PTT, and if you correct with a 1-to-1 mix, it will not correct because there's a factor inhibitor and not a factor deficiency. Could also be hard to diagnose if somebody's already on anticoagulants. That's a lupus anticoagulant screen. Okay, anti-cardiolipin antibodies, the strongest is an IgG, then IgM and IgA, and the same with anti-beta-2 glycoprotein 1, a little more sensitive. This is how you diagnose this. Okay, now what do you see with the antiphospholipid antibodies? Patient with a DVT or a pulmonary embolism, you're not sure of the cause. This is something you have to think about. This is one of the tests that you have to screen for. You could see somebody with a stroke or a thrombosis in an unusual place, like a splanchnic vein thrombosis. As mentioned, stroke. The other things, these people could have valvular heart disease. They get a valvulitis. And the old Lippmann-Sachs endocarditis, which was reported in lupus, is actually due to antiphospholipid antibody syndrome. Sometimes these patients have levator reticularis. There's a certain flavor of this that's one of the most prothrombotic conditions that exists, and it's called CAPS, catastrophic antiphospholipid antibody syndrome. These patients present with small vessel microthrombosis, and it's a thrombotic microangiopathy. It can involve the lungs, the kidneys, the heart, the liver. To diagnose this, you need classically 3 or more organ systems. It occurs within a week. It's very rapid onset, and they have positive antibodies. So, when are we going to see this condition? We're going to see this condition. We're going to be diagnosing the regular antiphospholipid antibody syndrome in a patient with the DVT or a pulmonary embolism. We don't know the cause. Possibly they have symptoms of lupus, or they have diagnosis of lupus already, or perhaps a woman with multiple miscarriages should have to be checked for this. How do we treat this? Normally the treatment for this is a little different. Although DOACs have really become the treatment of choice for thromboses, we treat this with warfarin, especially if you're triple positive. Okay, the 2 studies are the RAPS and then later the TRAPS study, which shows there's less recurrence. So if a patient has the antiphospholipid antibody syndrome, they're going to be treated with warfarin, not a DOAC. Now, if they have the catastrophic antiphospholipid antibody syndrome, they're going to be treated with steroids, high-dose steroids, and also IV heparin, and possibly even more aggressive therapy like plasmapheresis. That's with CAPS. Now, most antiphospholipid antibody syndrome does not involve that. Once again, when do we think about this with DVT and PE, but the arterial diseases, a young person with a stroke, a young person with an MI, we have to think of this. And we also have to think about it when you have thrombosis in an unusual location, like portal vein thrombosis or hepatic vein thrombosis. And that's all I have to say about this condition. Thank you.